and welcome back to my channel. This is Riddhi Makwana. The topic for today's video is CBC, that is complete blood count, and its usefulness in detecting blood cancers, and what is the prognosis and what is the help of a CBC test in the treatment of blood cancers. So, a complete blood count test or a CBC test will help you to determine number one, to help you diagnose the type of blood cancer you have, for example, leukemia or lymphoma. Then, to find out if the cancer is spreading to your bone marrow. Number three, to find out how a person is handling or how the person is responding to the cancer treatment. Number four, if there are other non-cancerous conditions which are affecting your blood and the bone marrow. And lastly, to determine if your doctor is giving you a cancer treatment, how is your improvement, how is the result to the treatment. So, while during this process of your treatment, your doctor will most likely recommend you a CBC test to see the results of the treatment. So, the CBC or a complete blood count test determines the amount of three most important blood cells in your body. The number one is the white blood cells or the leukocyte count present in the blood sample. So, why is it so important? Because the white blood cells or the leukocyte count, it helps to prevent the invading bacteria, invading viruses, and on the top of it prevents and creates a protective shield to fight against cancerous cells. Then there are white blood cells differentials which are also important and which are also included in your CBC reports. These are erythrocyte counts, monocytes, leukocytes, eosinophils and basophils. Then the RBC counts or the erythrocyte counts. So this is very important because it also helps you to determine the hematocrit count, that is the number or the amount of red blood cells present in your blood, and the hemoglobin, the protein which your RBCs carry. So the RBC count or the erythrocyte count is very important to determine the health and the good blood quality of the patient. Then the platelets count. So the platelets count should be in a very adequate number in a CBC because platelet is a protective mechanism against any invading foreign substance, and if it is cancer, the platelet counts should be in the adequate number to fight against cancer. So now we will see what all these numbers and what are the significance of these numbers with relation to cancers. So talking about the relation of cancers and the CBC, certain types of treatments of cancer, for example chemotherapy, is responsible for a low white blood cells in your body. On the other hand, bone marrow cancers or blood cancers such as leukemia, lymphoma and multiple myeloma are responsible for the low white blood cells count in your body. Similarly, low platelet counts is also responsible or is a response of chemotherapy in your body. Low erythrocyte count, that is low RBC count, which is also a classical picture of anemia, is also a response of chemotherapy in your body. So this way, the chemotherapy or other types of cancer treatments are responsible for the decreasing or the increasing of the numbers in your body. So its usefulness. As we have the stats of the previous data and the present data, we come to know what is the prognosis and what is the results and what is the improvement in the condition. So a CBC, which is a diagnostic test, is very useful in determining the prognosis and the improvement in the condition of the patient. So whenever doctor recommends you a CBC test, it is a very useful test and it is a very important tool in diagnosing the treatment and the improvement of your treatment. I hope this information is helpful and you are getting benefited from these videos. You can visit our Facebook page or our website for more such interesting videos. Have a good day. Thank you.